Hello, everyone, and welcome to 3M's presentation of Risk Management in the Central Sterile Services Department. I will be your presenter for today. My name is Anna Castillo-Gutierrez, and I have over 10 years of experience in the Sterile Processing Department. I've been a supervisor, a manager, and also an educator in the field. Our presentation authors are Dr. Jean Bronzati and Dr. Rafael Quiroz de Sosa. They are both invited researchers and professors at private and public universities and registered nurses as well. Some important information for you today. The context of this webinar is based on current United States information, including regulations, standards, guidelines, and practices as of August the 2nd of 2022. Requirements in other countries may be different, and U.S. guidance may change in the future. Always consult product instructions for use and follow local laws and regulations. This presentation contains an overview of general information and should not be relied upon in isolation to make specific decisions. Our objectives for today is to introduce the concepts of risk in the Central Sterile Services Department and introduce the tools and methodologies to manage and reduce risk in a responsible and ethical manner. So let's start by defining a couple of terms. The word risk is a probability or threat of harm, injury, loss, or any other negative occurrence that is caused by external or internal factors. They are vulnerabilities that can be avoided through preventative actions. Risk in central service departments are failures in one or more of the medical device reprocessing steps that can result in non-sterile items. And we know this. We know that there's a lot of things that can be prevented in our department. The word hazard is a particular agent of interest that has hazardous properties or can cause harm to our patients. And then risk management is a method used to assess the risk of a specific activity and to develop a program to reduce that risk or mitigate that risk. The risk management process involves a systematic application of policies, procedures, and practices using as premises the establishment of the context found in assessments, treatments, monitoring, critical analysis, records, and the risk reports that will be reviewed. Risk management must be an integral part of the organization's management and decision-making and be integrated into the organization's structure and processes. It can be applied at the strategic and operational levels. However, the dynamic and variable nature of human behavior must be considered. That means that you have to know the staff and the end users that are actually going to be applying the practices. It is composed of multiple steps that will be detailed in the following slides. Processing of reusable medical devices is a complex process that requires the supervision by competent personnel with relevant experience, especially in cleaning methods and products that promote the reduction of organic and inorganic residues from medical devices. They should also be knowledgeable about sterilization and disinfection methods, aiming at the prevention and control of infections and maintenance of standard precautions within the department. Factors associated with the complexity of the process performed in the CSSD, such as the separation of tasks, the differences in design of medical devices, cultural differences, knowledge and experience, all of these things increase the risk of failure within our department, and we need to be knowledgeable about every single thing that happens within our department to reduce those risks. The evolution of surgical techniques and medical devices is a big step forward in healthcare, and it's resulted in the improvement of quality for our patient care. Surgical instruments usually used in conventional surgical techniques are less complex for reprocessing, but with the arrival of minimally invasive surgery, including robotic surgeries, surgical instruments have become more complex and the cleaning processes have become a major challenge. And as a result, these challenges compromise subsequent steps such as sterilization and disinfection. The complexity of surgical instruments such as long and narrow lumens or lumens with crevices and joints make cleaning difficult and increase the risk of retaining organic residues and microorganisms that can cause or increase risks for infections. Whenever we have failures in cleaning medical devices, it reduces the effectiveness of disinfection and sterilization processes and favor cross-infections. Liposuction cannulas and scissors, for example, the images that you see here, you can clearly see that there have been some issues in the reprocessing steps where we're not able to effectively clean these instruments simply because of the complex design that they may have, and the brushes or the cleaning utensils that we're using in decontamination may not be as useful as we thought. In CSSD, there are numerous risks related to the structure and also to the reprocessing. For example, here you can see that there can be failures in the cleaning steps. There can also be failures in the inspection part of it in prep and pack, sterilization failures such as autoclave overloading, selecting the wrong cycle, for example, and even equipment malfunction can happen. In sterile storage, there can also be issues with the environmental controls that you have. Maybe the temperature or the humidities are off. And even related to sterile barrier systems, for example, if you have instruments that have been sitting on the shelf for an extended period of time that haven't been checked for sterility, those kind of issues can escalate the infections that we have within our organization. As I stated before, risk management processes involve a systematic application of policies, procedures, and practices using as premises the establishment of all kinds of records that you should be reviewing. In your healthcare organization, risk management must be an integral part of how you come to a conclusion of a process that should be established. And it can be applied at the operational level and also at the end user level as well. And you should take that into context to make sure that these processes that you put into place are user friendly. It's composed of multiple steps that can be that are going to be detailed in the next following slides. Since the risk management process can be applied at different levels, it's important to be clear about the scope and consider the objectives and align with your organization's goals as well. Establishing the scope, context, and criteria is intended to customize the risk management process, allowing for an effective assessment process, and appropriate risk treatments should include defining the objectives and decisions that need to be made, establishing the expected results. What do you hope to gain at the end of this process? You want to establish the time, location, and specific inclusions and exclusions. Think about the things that you don't want to include in your project. Use of appropriate tools and techniques for the risk assessment so that everyone involved is also aware of the tools that they're going to use. Make available the necessary resources as well. So different tools, electronic or cloud-based systems, make sure that those are shareable, responsibilities and record to be carried out. So make sure that everyone knows what their responsibilities are in the project so that they can carry them out, and risk management processes related to other projects. If these goals or your objectives are in line with other projects or affect other projects, then your team needs to be made aware of that as well so that they can be in line with those objectives and those goals as well. So here's an example of a project that took place. So they were evaluating cleaning lumened items within the ultrasonic washers. And so step number one, their objective was to mitigate the risk of soil in lumened instruments after cleaning in the ultrasonic washer. That was their goal. Their hope was to result in ATP cleaning tests with a value less than 30 RLUs. And so that was their hopes that they would gain at the end of the process. The time, location, and specific inclusion. So only for the 30 days, instruments with lumened items smaller than 5 millimeters were going to be monitored. They brainstormed and explored potential risk in the process, organization of process flowcharts. So they used different tools to effectively view what the current process was and what the possible problems were going to be. So they tried to identify where those points would cause issues within the flow. Make available the necessary resources. So these resources were dedicated professionals for receiving and processing instruments with lumens, ATP tests for monitoring, and appropriate forms for information records. And so they provided these tools to the end user so that they can collect this data. And risk management process related to other projects. So safe surgery, that was the goal of the organization. And so the end results were aligned with the organization as well. Risk criteria must reflect the organization's values, objectives, and resources and be consistent with institutional policies. To establish risk criteria, it's worth considering the nature and the type of uncertainties that may reflect results and objectives, both tangible and intangible, as well as the consequences, both positive and negative, and probabilities of the occurrence happening over and over again. You also want to consider how the combination and multiple risk consequences will be taken into consideration. What results is your organization willing or not willing to accept, for example? Here, you can see that they're willing to accept certain results concerning the ATP testing that they have established. The risk assessment process includes identification, analysis, and evaluation. The evaluation process must be carried out in a systematic, interactive, and collaborative manner. And so you want your team to have all of this information at hand so that they can better identify what their target issue really is. And so here's an example of the causes and events. So the results of cleaning monitoring shows a value above the limits that they're willing to accept. Some of the threats that they have are surgical site infections. Those are the possible things that could happen. And then the opportunities are they want to reduce the events related to the risk of postoperative infections. The vulnerabilities and capabilities, so equipment that could fail. They have instruments that are not disassembled for cleaning, lack of personal training, inappropriate detergents that could be used, people not following the IFUs of instruments, or maybe the IFUs may not be relevant as well or up to date. And equipment and a detergent. Maybe you have the equipment that you need. Sometimes you might find within an IFU that you don't have the established equipment that you could possibly need for reprocessing. And so some of the changes of external and internal context. So sometimes you're going to be identifying the need for replacing the washer disinfector, so the ultrasonic washers. Or maybe there are instruments that need to be updated as well. And so you're identifying all the possible risks that could be associated with your project. Here are a few more examples associated with the project that we're talking about. So factors to consider. Some of the things that they're identifying within this project is emerging risk indicators. So possible infections in patients that are using these instruments, consequences and their impacts on the objectives for the project. So there's an increased morbidity or mortality rate, limitations of knowledge and reliability of the information. So one of their concerns that they may have identified is lack of training of the team that's going to be participating in the project. So how accurate will the records be from the staff or the technicians that are providing the data that is needed for the project? Temporal factors, so equipment that is down for a while or resources that may not be available for the team, and some of the biases or hypotheses and beliefs of those involved. Some of the end users may simply not follow the established policies and procedures that they have put in place within the facility. So once you have identified your actual risks, now you can do a risk analysis. So you want to understand how each of the risks that you have identified plays a part within your project and how you can break those down to mitigate those risks. So here, as an example, flushing distilled water into the lumen at the point of use. You want to identify if it's actually happening within your department or within your process. Risk analysis can be performed with varying degrees of detail and complexity. So depending on the purpose of the analysis, the availability of information and available resources is going to play a part in that. The technique can be qualitative or quantitative or combined depending on the circumstances as well. So again, in the example, maybe the staff don't understand that some of the devices come apart, or they may not be following the IFU and disassembling the device at point of use, or pre-cleaning may not be happening. So the purpose of the risk analysis is to really understand the nature of the risk and its characteristics, including the level of risk. In this step, uncertainties, risk sources, consequences, probability, and events and scenarios controls and their effectiveness should be considered. An event can have multiple causes and consequences and can affect multiple goals as well. The purpose of conducting a risk assessment is to support a decision, whether it's a decision that you want to make or that your team wants to make. This step involves comparing the results of the risk analysis with established criteria to determine whether further action is needed. And so one of the decisions that you might make or that your team might make would be to, the ones that are here in this box, accept the risk and do nothing because it is a low impact or it is a step that's essential to the process. One of the other decisions that you might make is to consider risk treatment options to either eliminate that risk or mitigate that risk. You also could conduct additional analysis to better understand the risk if it's something that maybe has never been presented before. A decision that could possibly be made is to maintain existing controls. For example, if you have a policy and procedure or SOP that is already effective, and the staff simply need re-education, that could be an option as well. It's important that the decision considers the broader context and the real and perceived consequences for external and internal stakeholders. For example, how is it going to affect the end user? Is the new process going to make it a little bit more challenging for them to perform? And how is it going to affect the patient as well? The results of the risk assessment must be recorded, communicated, and then validated at the appropriate levels of the organization. Risk treatments aim to implement actions to mitigate or eliminate the risk. It is an interactive process that aims to formulate and select options to address risks. There is planning and implementation that are involved. It evaluates the effectiveness of the proposed treatment. And so as you're going through these, you want to make sure that any treatment or any idea that the team may have to actually implement changes to the process, that they're actually effective at the end user level. And so continuing on with the steps, assess and decide whether the remaining risks are acceptable. So once you have placed the treatment into use, you want to go back and reassess and make sure that it is at an acceptable level of what your end results are identified as. And if it's not acceptable, performing additional treatments or maybe putting other practices or processes into place to finally eliminate or reduce the risk that you're trying to treat. Selecting the most appropriate risk treatment options involves balancing the potential benefits derived against the achievement of objectives against the cost, effort, or disadvantages of implementing. Options for treating the risk may involve some of the following here. So maybe avoiding the risk by deciding not to start, or even continuing the risk because you see that it is a low risk that's involved to the patient. The next one may be taking or increasing risk in order to pursue an opportunity. Removing the risk source. So sometimes if you find in the process that there is a certain tool that's increasing a risk, maybe even removing that tool and finding another tool that's more effective might be a solution there. And so there's different types of risk treatments and options that you could take whenever you have found and identified those risks. The risk management process and its results must be documented and reported through appropriate mechanisms. So any record aims to communicate activities and results, provide information for decision making, improve risk management activities, and assist interactions within stakeholders, including those responsible for the risk management of that task. You want to remember that it is a team effort, and so because you have different people that are involved in this task, you want to make sure that you're recording any and documenting any results so that you can bring back to the team eventually and make a decision from there. So here, communication seeks to promote awareness and understanding of risk, while consultation involves obtaining information for decision making. The purpose of communication and consultation is to assist in understanding the risk, the information used for decision making, and the reasons why specific actions are required. The close relationship between communication and consultation facilitates the exchange of factual, timely, relevant, accurate, and understandable information, taking into account the confidentiality and integrity of the information, as well as the right and privacy of the individuals involved. So the consultation communication aims to gather different specialties for each step. So you're going to have a variety, or you should have a variety of people that are involved within your process, within your project, ensuring that different viewpoints are properly considered. And so people are going to bring different ideas. The different people that are involved should be from different departments. And so they're going to have a different viewpoint or understanding, or maybe even idea of the project and its goals. You want to provide sufficient information to facilitate the risk, supervision, and decision making. And you also want to build a sense of inclusion and ownership amongst the parties involved. And so, especially when it comes to considering the end users, you want to make sure that they have input in the project as well, so that they can then, in turn, produce the goals or the objectives that you're trying to produce. Throughout the project, continuous monitoring and periodic review of the risk management process and its results should be a plan set with established responsibilities. The results of monitoring and review should be incorporated into the organization's performance management, measurement, and reporting activities. So the objective is to ensure and improve the quality and effectiveness of the design, implementation, and results of the process throughout that project. In summary of the content presented, risk management involves the following activities. So, number one, process mapping, which I'll go into detail in just a bit. 2, identify the risk. 3, evaluate failure mode or modes. And 4, selecting risk priorities in those modes. And then eliminating, mitigating, or accepting certain risks. Here's an example of a process map. The process mapping starts with the design of the macro process, or the bigger picture, using the diagram in block format. The macro process to be analyzed is selected to identify the possible risk present, and then the micro process flow is then drawn using the symbols presented on the next slide that I will show next. There are a variety of programs that you can use to create process maps. But in simplistic forms, you can also use these different symbols to identify different meanings throughout the flow charts. So here you can see that this oval shape is going to be your start or your finish, and then the arrows here are going to be the flow or the direction that your flow is going into. You also have symbols for sub-processes and decisions that you need to then take to show your end user how to properly move through a process that you have created. When an adverse event occurs, the mapping of the established process should be performed. The risk can be identified to analyze which elements were responsible for the results. And so you can use your process map, but then you can also create an Ishikawa diagram, or also known, more familiar to us, a fishbone diagram, in where you can simplify or identify, in more simpler terms, where the failure actually occurred. Here's an example of the Ishikawa diagram, or the fishbone diagram, in where you have identified possible risks that are associated in that process that were derived from the process map previously. So here, some of the things that you have identified might be the equipment, so lack of maintenance or lack of qualification. There's also the materials that were involved, so lack of ATP test swabs, or failure to dilute the detergent properly, or reuse of the detergent, and so that may have caused an adverse event at the end. And so in simplistic terms, again, you're able to more clearly see or view what steps of the process could have been the issue. Failure mode and effect analysis, or FMEA, is one of the most widely known or adopted techniques for conducting a proactive risk assessment. We suggest this tool to define, identify, and eliminate known potential failures. And there is a very good resource website that you can use to gain more information on it. So you can go to patientsafety.va.gov and you can download different materials there that walk you step by step through the FMEA process. But number one here, it can help you define the topic, assembling the actual team, graphically describing the process, and conducting a hazard analysis as well. And then finally, actions and outcomes measures. So actually taking that information that you had and finally creating data out of it to prove that you have effectively put a new process into place or kept the process in place. Here are different treatments that you can apply to the risk that you have identified within your project. So some of the things that you could possibly decide to do is going to be to either eliminate, so systematically produce the SOP step by step, or to clean according to the IFUs. The second decision that you could possibly make is to control. So maybe you have identified that the SOP or the policy that is in place currently is already effective, and so retraining or training the clinical staff on the actual process that's already in place, and then cleaning monitoring with inspection and chemical tests. So if a process has already been identified as clinically sound, then you can then take proactive steps to maybe manage that process a little bit more effectively by doing ATP testing or something very similar to that. And then the last decision that could possibly be made is to accept the process as it is. Possible, like for example, identifying that there are possible debris inside of narrow lumens, and just understanding that some of the instruments that we may have or come in contact with may not be able to be viewed on the inside because of the narrow lumens that are there. The final message in this presentation is that the risks are inherent in our Central Sterile Supply Department. There are multiple risks associated in our department, and we need to better manage those risks. And risk management and having programs in place to reduce those risks should be completed within your department periodically. A periodic review of practices performed in CSSD may reveal the presence of risks that result in adverse events to patients or professionals. Risk management in CCSD is necessary to prevent preventable adverse events from reaching patients, such as nosocomial infections. Here are today's references that we used in today's presentation, and thank you very much. We hope we see you guys again.